recently I've spoken about weight loss jabs and how some GPs allegedly, apparently, are having to meet targets in terms of how many people they um, refer to get these injections, and there's money involved. I think you get a certain amount of money if you get a certain amount of people onto these or referred to for these injections. And I spoke about how that can be bad, and most people don't need these injections. And if you're referring to other programs in terms of uh, diet, food, uh, fitness, health, and exercise and stuff like that, then that's far better than injections. We've seen side effects and other issues. And also, let's say let's say someone does take the jab and is fine, there's no side effects, and they lose X amount of weight. But when they finished, then because they've not been in a habit of making changes to maintain that, they've just taken an injection, then what happens? And now we have news from a BBC News article. 2 deaths reported to drug watchdog for potential link to weight loss jabs. The deaths of 2 people in Northern Ireland potentially linked to weight loss injections have been reported to the government agency responsible for ensuring medicines are safe. The 2 cases are among more than 500 suspected adverse drug reaction reports submitted from Northern Ireland over the last 2 years related to GLP-1 medications. The drugs prescribed under names such as Wegovy, Mounjaro, and widely used across the UK for weight loss, weight management, and to treat diabetes. The reports were made to the Medicines and Healthcare Products Regulatory Agency. The MHRA said a report of a suspected reaction does not necessarily mean it has been caused by the medicine, only that the reporter had a suspicion it might have. You can read the rest of the article online. And of course, you can say it doesn't necessarily mean it's because of the injection or other things. Just like with anything else, you have to investigate and check. And also, you could potentially see with other people if they've had similar reactions. But at the same time, you can't just dismiss it like that. You could have just said, we don't know, but we were looking into it. But this statement seems like, oh, it doesn't mean that it's the injection. It seems like you already painted a picture in your mind what it is. And of course, if someone hasn't had the reactions before, and they're eating the same stuff, they're drinking the same stuff, they're doing the same stuff, and then now all of a sudden they're taking this injection, it's a very good chance that it could be this. But to be giving a statement like that, it seems like you're already dismissing it, which is a concern. And I'm not surprised either, because many people are pro these injections, and I've spoken about many people are even having to meet targets and getting money for getting people on these type of things. But I wouldn't expect that from someone who's supposed to take a report to be saying that. But it'll be interesting to see how this impacts people taking these drugs going forward.